Part 2 of the bronchial asthma. Diagnosis. There are 3 steps of the diagnosis of the asthma. The first step is to confirm the initial diagnosis of the asthma. And the second step is to assess the severity of the asthma. And finally, to search for the comorbidities. These 3 steps we have learned before is useful for almost the disease. Firstly, let's look at the first step to confirm the asthma. After we collect the information of the symptoms, histories, and signs from the patient, which patients do you think are likely to suffer from the asthma? That means the suspected diagnosis of the asthma. Okay, let's look at them. Firstly, if a patient got episode in use, they are likely to suffer from asthma, but not COPD. And the second factor is about the typical symptoms. If the patient complained the wheeze, short breath, and their attack suddenly with trigger, or this patient complain chronic dry cough or chronic chest tightness with triggers, they are likely to suffer from the asthma too. In the third condition, if the patient complained respiratory symptoms such as the dry cough, chest tightness last for 2 months. And finally, some people maybe suffer from atypical symptoms for unknown reasons last for 2 months. If the patient fit any one of these conditions, we can suspect the diagnosis of the asthma. Here shows the diagnostic criteria of the asthma. We can follow this diagnostic formula to confirm the diagnosis of the asthma. There are 5 points in the diagnostic criteria of the asthma. Let's look at them one by one. The first point is about the symptoms. The patients usually present the untypical symptoms of the dyspnea, cough, and chest tightness. The second one is about the signs, including the prolonged expiratory phase and wheezing during the auscultation. Furthermore, we can also find some positive signs caused by the emphysema. And the third one is about the response to the therapy. The asthma patient usually have a good response to the bronchodilators. The symptoms can be relieved after treatment. And the point 4 is to exclude other differential diagnoses. We will talk about them later. And finally, the 5 points is about the spirometry. The excessive variability in lung function can be found in the asthma patients by the positive results of one of these 4 examinations. If the patient fit point 1 to 4 or fit the point 4 and 5, we can confirm the diagnosis of the asthma. So, in this diagnostic criteria, we can find that the spirometry is not the necessary criteria for confirming the asthma, because in many cases, the asthma patient maybe got a negative results in the spirometry. The reasons maybe include some patient taking the spirometry after using the bronchodilators, and some patient may be taking the spirometry in the chronic stable stage, and other patients may be with a predominant neutrophilic inflammation, which is lack of the L hyperresponsiveness. So, the spirometry is not the necessary criteria for the diagnosis of the asthma, but the point 4 is the necessary one. Let's look at these formulas. Once we diagnose asthma, we need to exclude the differential diagnosis. And now let's look at this differential diagnosis. The differential diagnosis of asthma include chronic obstructive pulmonary disease. We will talk about the differences between the asthma and COPD in the end of this class. And acute left heart failure, also called cardiogenic asthma, and ABPA. We just talked about this in the class of the pneumonia. And diffuse universal bronchiolitis, upper airway disorder, and others. And finally, once we confirm the diagnosis of the asthma, we also need to confirm the stage of the asthma patient. Chronic stage, or acute onset stage, or acute exacerbation stage. The chronic stage of the asthma present no respiratory symptoms or with stable respiratory symptoms. And the acute exacerbation stage usually present the exacerbation of the respiratory symptoms triggered by any kind of the stimulator. In this condition, there will be increased inflammation and worse airway hyperresponsiveness. And that's the first step to confirm the initial diagnosis. And the second step is to assess the severity of the asthma. There are 3 tables of the assessment for the severity of the asthma. It's all rather confusing, right? But please don't worry. Let's learn them one by one. We need to analyze the meaning of this assessment and how to use this assessment. Okay, let's look at here. Here shows the 3 approaches of the assessment in your textbook. The first one is the classification of the severity of the chronic stable asthma. It's the assessment for the chronic stable asthma. And the second one is the classification of severity of asthma exacerbation. And this assessment is for asthma exacerbation. And the third one is assessment control test. This assessment is for the chronic stable asthma with therapy. Let's look at them one by one. The first one is the classification of severity of chronic stable asthma. In this table, we can know that the chronic stable asthma can be divided into 4 groups, including the mild intermittent, mild persistent, moderate persistent, and severe persistent, according to the symptoms, nighttime symptoms, and lung function. And how we can use this result of the assessment for the chronic stable asthma. Here shows the value of this assessment is to determine the initial therapy for chronic stable asthma. We usually use this assessment at the first diagnosis of asthma. And the second assessment is for the classification of severity of asthma exacerbation. Okay, in this table, we can note that the patients with acute exacerbation of the asthma can be divided into 4 groups: mild exacerbation, moderate exacerbation, severe exacerbation, and impending respiratory failure. The items in this scale include symptoms, signs, and auxiliary examinations. The value of this classification of severity of asthma exacerbation is to determine the initial treatment for the acute exacerbated asthma. It presents the differences in the dose and frequency of the bronchodilators. The third one is about the asthma control test. This scale is for the asthma patients who take appropriate regular treatment at home. They can do this assessment in each month. According to these questions, they can be divided into wide control asthma, not wide controlled asthma, and very uncontrolled asthma. The value of this asthma control test is to determine the adjustment for the chronic stable asthma after initiated therapy. Those are the step 2 to assess the severity of asthma. Step 3 to search for the comorbidities, including the pneumonia or other respiratory tract infection, respiratory failure, obesity, and other allergy disease, gastroesophageal reflux disease, and others including the acid-base or electrolyte imbalance. We need to search for these comorbidities to complete the individual therapy for the specific patient. And that's the diagnosis of the asthma patients. Now, let's move to the treatment. The approaches of initial treatment is similar to other diseases we have learned before. There are 3 parts of the initial treatment. Part 1, treatment for the cause. That is the chronic inflammation and allergens of the asthma. Part 2, treatment for the symptoms, including the dyspnea, cough, chest tightness. And part 3, treatment for the comorbidities. The drugs for asthma can be divided into 3 groups. The first group is called controller medications, including the long-acting beta-2 agonists, LABA, long-acting anticholinergics, LAMA, inhaled corticosteroid, ICS, leukotriene modifiers, and theophylline. We can know that most of these controller medicine can be used in the patient with COPD. And another group is called reliever medication, including the rapid-acting or short-acting beta-2 agonists, or anticholinergics and systematic glucocorticoids. The reliever medication can be used for the patients with acute onset asthma, which require to alleviate the symptoms in a short time. The administration routes of this drug is the same to the patient with COPD, including 3 routes: through oral, through injection with wings, and inhaled by the nebulizers, or middle-dose inhalers. Let's look at some important types of the drugs for the asthma patient. The first one is the corticosteroid. We have learned before in the patient with COPD. But the corticosteroid play a much more important role in asthma than the COPD. It is considered to be the most important agents in asthma. The drugs are the same to the COPD. In the adverse reaction we have learned before, just pay attention to the infection by the opportunic microorganisms. This table shows the drugs for the asthma patient. We just need to pay attention to the group of the daily dose: low daily dose, medium daily dose, and high daily dose. Later, we will use this dose in the treatment for the chronic stable asthma. The second drug is called leukotriene modifiers. The montelukast is the most popular drug in China. The mechanism of this drug is to reduce effect of the leukotrienes, which can induce mucosal edema. This type of the drugs are the most important assistant drugs in the therapeutic regimen for the asthma patient. Moreover, they are also useful for the patient with the allergic rhinitis, which usually coexist with asthma. The third drug is called antihistamines drugs. For example, ketotifen. The mechanisms of these drugs is to reduce the edema caused by the histamine and stabilize the cell membrane structures of the mast cells. It is one of the assistant drugs for the treatment of the asthma patient, but the effect of these drugs is mild or moderate. Another effective drugs, anti-IgE agents, including the omalizumab, should also be measured and is commonly used to treat the severe persistent asthma or severe asthma exacerbation. The mechanisms of these drugs is to decrease the concentration of the IgE. Here shows other therapies for the asthma. Bronchial thermoplaster. As this picture showing, we can know that in the asthma patient, the bronchi will be narrow caused by the proliferation of the epithelium and the smooth muscle cells. So, in this condition, we can choose a main narrowing bronchus to send a apparatus to this narrowing bronchus through the bronchoscope, and next to hit this apparatus to destroy the redundant tissue in the narrowing bronchus. So, in this condition, the narrowing bronchus can be recanalized, and that is the bronchial thermoplaster. Now, let's look at the therapeutic regimens for each group of the asthma patient. According to the classification of the severity of asthma exacerbation, the patients with acute exacerbation asthma can be divided into mild, moderate, severe exacerbation, plus or without respiratory failure. And the therapeutic regimen are according to the severity of the asthma exacerbation. For the patients with acute onset of the asthma, to avoid allergy is the most important treatment for these patients. And once the patient combining with a pneumonia, for the bronchodilators and corticosteroid, the dose and frequency are different in different groups of the asthma exacerbation. The thiocylin and leukotriene modifiers can also be added into the regimens. Oxygen therapy can be used for the patient with dyspnea. And if the patient got a severe dyspnea or with a respiratory failure, the mechanical ventilation can be used for these patients. Those are the treatment for the asthma in the acute exacerbation stage. For the asthma in stable stage, the therapeutic regimens are according to the severity of the chronic stable asthma. Let's do a review. In this table, the patients with chronic stable asthma can be divided into 4 groups: mild, intermittent, mild persistent, moderate persistent, and severe persistent. Here shows the treatment steps. Okay, let's look at the details of the steps together. Firstly, we should notice here the needed rapid-acting beta-2 agonist is required in all of the step 1 to 5. And in the step 1, the regimen is just needed rapid-acting beta-2 agonist. Step 2, the recommended regimen is the low-dose ICS plus needed rapid-acting beta-2 agonist. And the Alternative regimen include the leukotriene modifier. For the step 3, the recommended regimen is low-dose ACS plus LABA. And these are the alternative regimens for the step 3. Step 4, the recommended regimen is medium or high-dose ICS plus LABA. And here shows the alternative regimens for the step 4. And for the step 5, we can dose the oral glucocorticoids for the patients in step 5. And for these patients, we can choose the anti-IgE treatment, such as the omalizumab. Now, how to choose the initial treatment for the patients with first diagnosis of the asthma in stable stage? We just talked about that. We can choose the treatment according to the severity of the asthma in stable stage. For the mild intermittent group, we choose the step 1 for this patient. In the mild persistent group, we choose step 2 or step 3 for this patient. For the moderate persistent, we choose step 3 or step 4 for this patient. And finally, for the severe persistent patients, we can choose step 4 or step 5 for this patient. So that's why I said that diagnosis determines the treatment. This page shows the adjustment of the therapy for the asthma in the stable stage. We just talked about that. The adjustment of the therapeutic regimens is according to the scale of the asthma control test. If the results shows the controlled, we can consider to maintain or find lowest controlling step for these patients. If the results of the ACT is the partly controller, we should consider stepping up to gain the control. And if the result of the ACT is uncontrolled, we need to step up the therapy regimen until controlled. And if the patient in the acute exacerbation stage, we need to treat as exacerbation. That's the methods for the adjustment. Other treatment for the asthma patient include to avoid allergy, bronchial thermoplasty, and treatment for the comorbidities. Now, let's do a brief summary of the steps in the diagnosis and therapy for the asthma. Firstly, according to the symptoms, signs, allergic history, and family history, we can suspect the diagnosis of the asthma. And next, we need to do some auxiliary examinations to confirm the initial diagnosis of the asthma. That is the 5 criteria of the asthma. After we confirm the diagnosis of the asthma, we also need to confirm the stage of the asthma, which is related to the therapy for this patient. And next, we need to do some assessment. We can do these assessments according to the stage of the asthma. The severity of the acute stage for the patients with acute exacerbation asthma, and the severity of the chronic stage for the patients with chronic stable asthma. And finally, do not neglect the comorbidities. Finally, we will move to the treatment. The treatment is also according to the stage of the asthma and the severity of this stage. For the acute exacerbation asthma, we choose the therapy for this acute stage. And for the patients with chronic stable asthma, we choose the initial therapy for the chronic stable asthma. And several months later, we need to assess the treatment effect by the scale of the asthma control test. We usually ask the patient to do this assessment each month. According to the result of the ACT, we can do appropriate adjustment for the initiate treatment. That's the steps in the diagnosis and therapy for the asthma. And the contents in red is the most important for this class. You need to remember them in mind. And now, we will have a case discussion. This page shows the medical record of this patient. You can read by yourself. I will give you 1 minute. And think about this question. What are your initial diagnoses? Okay, can you find the answer to this question? Before we try to answer this question, we need to find some correct method to do this case analysis. That is, to pick out the positive information about the symptoms, physical examinations, and auxiliary examinations. That is, this patient presents recurrent shortness of the breath and wheezing, and cough, sputum. So we know that this patient got a chronic dyspnea and cough in recent 3 days. He got a thick sputum. And during the physical examination, we can find the increased respiratory rate. Cyanosis shows the dyspnea, right? And wheezing rails in both lungs shows the bronchospasm. In the X-ray, the lung translucency increased, shows the emphysema, and the lung texture increased slightly, shows the suspicion of the bronchitis. And the count of the white blood cell also increased, shows infection. And here, the partial pressure of the oxygen is slightly decreased, and the partial pressure of the carbon dioxide is increased too, and the pH also decreased. Serum potassium also decreased too. Okay, now we can know that before we pick out these positive findings during the symptoms, signs, and auxiliary examinations, maybe your initial diagnosis is asthma only. But after picking out these positive findings, what are your initial diagnoses? I think it's not only asthma right now, right? Okay, let's look at the answer to this question. The initial diagnoses include bronchial asthma with severe persistent with acute exacerbation. Because these patients feel with severe dyspnea in spring and symptoms last for 1 month, and all other positive signs can support the diagnosis of the bronchial asthma. And others include the acute bronchitis because of the thick sputum, and lung texture increased slightly in the chest X-ray. And during the blood test, we can find the increasing white blood cell and the neutrophil cells. All of these will support the diagnosis of the acute bronchitis. And finally, the hypokalemia, because of the decreasing of the serum potassium. So that's the initial diagnosis for this patient. Oh, I forget one. That is respiratory acidosis. Because of the increasing of the partial pressure of the carbon dioxide and the decreasing of the pH. So that's the initial diagnosis for this patient. And now, let's move to the question 2. What's the treatment plan for this patient now? Why I need to say now? Because we need to focus on the stage of the asthma. That is the acute exacerbation stage, but not chronic stable stage. The treatment for this patient is therapy, oxygen therapy, and we need bronchodilators for this patient. And these bronchodilators are required rapid acting, including the SAMA, and theophylline. Glucocorticoids for this patient is required systematic glucocorticoids. Antibiotics for the acute bronchitis. Using the expectorant to keep the air tract unobstructed for the acute bronchitis. And the correction of the acid-base imbalance. And finally, to provide potassium chloride solution through oral, but not injection, because of the slight decrease of the potassium. And that's the treatment for this patient now. This page shows the differences between the COPD and asthma. The basic pathologic changes in asthma and COPD are the same. That is the chronic inflammation. But the airway limitation in asthma is variable, and the air limitation in COPD is invariable. The cause of the asthma is allergen mainly, and the cause of the COPD is dust and particles. The first diagnosis of asthma is in youth, and the first diagnosis of COPD is in old age. And there are also other differences in the symptom reason, exacerbation, signs and symptoms, diagnosis and treatment. You can read by yourself, and you can also summarize some other differences between the COPD and asthma. Okay, that's all for this class. Thank you.